Welcome back to Midwest Access. June is Wound Healing Awareness Month, and so Dr. Lai is here to inform us why this is so important for our health. Thank you so much, Dr. Lai, for being here.
Thank you for having me.
Yes, and so sometimes I reference my former life. I worked in a nursing home as a dietitian, and so wound healing is something that I worked very closely with the nurses and doctors to get the proper nutrition and hydration. And so if you've dealt with this, you know what a challenge it can be to get some of those chronic wounds to heal.
Right. So the wound healing process is a very complex process of wound healing. And since it is a multifactorial process, it makes sense to have an integrated whole person approach. You cannot just do the wound, debride the wound, put a wound dressing there when the body is not ready to heal.
Right.
And that's why we talk about the healthy lifestyle, the 6 pillars. Number one, of course, is nutrition. We need the building blocks, and people don't usually realize that we talk about collagen. We have so many collagen drinks, supplements in the market.
So many products with collagen.
Right, and the collagen is a very picky molecule.
Really?
It has 3 steps to become the mature collagen molecule. Every step requires a mineral. We call it micronutrient. So they need vitamin C, need zinc, and copper. So we cannot just take the supplements all the time. The best way is coming from the food. So the vitamin C, of course, we all know, fresh vegetable, fruits. But then the zinc and copper, we have a lot of nuts, lentils, they will have that. You talk about arginine, of course, that's coming from the nuts also. And we also want an anti-inflammatory diet, reduce inflammation, or improve the circulation, all of that. But on top of that, since the collagen is very picky.
Okay, that's good to know because you see all these collagen products, so they're not all equal. Some are going to work better than others.
Right. Well, you eat into the body, then the body will digest it. It doesn't mean that the body will just take the whole collagen you eat and bring there.
Right.
So you still need all those micronutrients to produce the collagen. And one thing is very particular is it's related to our sleep. When I mentioned the 3 steps to produce collagen, the first 2 steps actually happens when we're sleeping. So during the daytime, the nighttime, we will have to produce those pre-collagens. And during daytime, when we're awake, the body will convert them to the mature collagen. So if we don't have a good sleep,
we're not going to be able to heal those wounds if we're not sleeping.
Right. So we don't have parts for the final product. So there's a lifestyle medicine. But especially for the wound, or when I talk about diabetic foot ulcer. It is very critical part with diabetes. It's a very pandemic right now for diabetes, and about 30% of people, depends on what you research, you read, in their lifetime they'll develop diabetic foot ulcer.
Wow, 30%.
Yes.
That's very high.
Right, about 20% will go into amputation.
Wow.
And diabetic foot ulcer is the #1 cause of non-traumatic amputations.
Really? Yeah, and if we can prevent that, I mean, when you think of your feet, you know, your balance, it's just so important to your overall health. And to be able to avoid an amputation simply by what we eat, our physical activity.
Right, so if we don't look at the root cause, and just by trying to heal the wound, it's really difficult because diabetes affects multi-system in the body, your circulation, your immunity, all of that, and the joints. So the basic is really to take care of diabetes and then uploading for the wound. Otherwise, there's a 60% of recurrence after amputation. It's 3 to 5 years.
Really?
So when we look at the 5-year mortality rate, so having a diabetic shark foot is about.
And we've got this graphic too. Maybe we can put that graphic up.
Yes,
there we go. Thank you.
So when we have an amputation, the 5-year mortality rate is more than 50%.
Wow, that's very high.
Right.
So it's a very serious issue.
Right. So when we talk about cancer, the breast cancer is 5-year mortality rate is about 10%. And then all cause is 27, just same as someone having a diabetic foot ulcer.
That is I mean, what is the word for that? That's a lot to think the 5-year mortality rate for all cancers is the same as a diabetic foot ulcer.
Right.
Yeah, it just shows how important it is.
Right. So we really need to take care of diabetes, to get a whole person, and not just taking care of the wound.
Yeah.
Yeah.
Yeah, and I love your approach at the Rochester Clinic too. Like you said, the lifestyle medicine. There's so many things that we can do and reverse our, people with high blood sugars
right.
that we can do simply by lifestyle.
Yes.
And we don't have to do medication. We don't have to do all those things. So how do we get in touch with you over at the clinic?
Health@rochester.com or 218-3095.
Okay.
And, yeah.
Yes, and get in touch with them. Yeah, you can turn around a lot of these statistics that sound so devastating.
Right.
Yeah. Thank you so much.